Tuberculosis is a worldwide endemic disease that causes 1.3 million deaths per year. According to WHO research, 2 of the 3 people that get infected with the disease and don't get treated die.
In addition, nearly 45% of the patients in developing countries get a misleading diagnostic because of the absence of sensible and specific diagnostic methods, creating thus a major worldwide concern. Tuberculosis is an infectious disease caused by Mycobacterium tuberculosis that is transmitted airborne by droplets of bodily fluids inhaled into the lungs. Symptoms include chest pain, coughing up blood, and fever. One person infected can spread the disease up to 15 more people a year.
Sufren en todos los laboratorios lo que son recursos humanos, no solamente como departamental, sino siempre en el área rural. Hasta los mismos médicos se están capacitando para ellos mismos hacer sus baciloscopías, ellos mismos procesar, hacer las lecturas.
Nosotros trabajamos con 5 comunidades, pero para el procesamiento de las muestras solamente puedo hacerlo yo. Hay pacientes que por su dejadez muchas veces vienen en etapas terminales de la enfermedad. Nosotros diagnosticamos y a veces a la semana ya fallecen. Falta de diagnóstico porque son personas que a veces es difícil encontrarlas, puesto que como son es como una selva eso, y ellos viven adentro.
Cuando es una baciloscopía negativa, sí o sí tenemos que recorrer lo que son los 300 campos. Ahí hacíamos como 30, 40, 50 baciloscopías por día, pero no se podía leer y uno se cansa la vista. 20 láminas como máximo. La clave es el microscopio, que esté en buen estado, que se pueda observar lo que son los bacilos, ¿no?
Bolivia has one of the highest prevalence, incidence, and mortality rates of the continent. Nearly 3.5 million people live in countryside areas where the diagnostic method is not adequate and the capable laboratories are very few. As mentioned before, the method in practice shows only 55.5% of sensitivity rates on well-trained laboratories. There are other methods with much more sensitivity and specificity rates, but low and mid-income countries cannot afford the cost of the machines as well as the learning process required to execute them. In short, until new methods get to developing countries, more people will die. Automatic Digital Microscope is an open source project dedicated to the development of affordable devices that eventually will automate the diagnostic of parasitic and bacterial diseases diagnosed using an optical microscope. For the Hackaday Prize 2016, we have selected tuberculosis as our target disease for automation. The project features 4 devices that are being tested on the main tuberculosis diagnostic laboratory in La Paz, and already present results that help in the diagnostic of tuberculosis. The project addresses the automation of tuberculosis by remodeling the conventional method proposed by Seal-Nielsen. The Seal-Nielsen precision dyes a sputum sample with fixin and methylene blue. When exterminating the slide under a microscope, the presence of red cone-shaped figures will determine the infection with Mycobacterium tuberculosis. The automatic digital microscope is the main device of the project, consisting of a hacked standard microscope. The microscope has been automated by adding step motors to each motion mechanism using 3D printed pieces designed from scratch by us. We've also embedded a webcam with a 3D printed piece to the microscope's ocular and a ring of LEDs to increase the contrast of the images. On the hardware side, we've added a Raspberry Pi 3 and an Arduino Uno as the microscope's main core. On the software side, we've implemented machine learning and computer vision algorithms that report an increased sensibility compared to human performance of above 90%, but at a cost of lowering the specificity by 10%. The biosecurity box has an automatic wireless controlled environment which serves to store samples for preventing the spread of the disease. The tablet creates a simple user interface, allowing to control the devices and also visualize medical records. The server allows intercommunication between devices, storing relevant data, making remote communication possible.
Nos apoyaría, nos aportaría bastante, ser lindo sería, o sea, suficiente un personal, ¿verdad? ¿No? Para hacer el extendido, pero ser bien. Y la lectura que solamente haga la máquina, lindo.
We're offering a low-cost, reliable, and easy-to-reproduce tool for research and diagnostics. It features a field of analysis up to 13 times greater than a normal person can sweep and in less time. All from $139. And the best part, it is open source. All manuals and documentation are available at Hackaday and Instructables.